This crisis has certainly, to me, cemented the need for a universal healthcare system that is independent of employment. Because if you have 40 million people who don't have jobs and they still are going to need healthcare, like we need to make sure that you can actually still take care of yourself.
My attitude, I'm not a fan of single payer, right? I'm a fan of a hybrid environment. And what I've always suggested, and actually I have a study that I funded with the RAM Corp that we're redoing right now because of all the issues of the pandemic. But effectively, it's a safety net, if you will. If you have your employer insurance, keep it, that's great. If you're on Medicare, that's great. If you're on Medicaid, that's great. If you're ACA eligible, USA becomes the insurer. But the key element that makes it different from traditional insurance is that you don't pay any premiums until you use the system. So if you're 20 and healthy, or 27 is a better age and healthy, and you don't need to use the system, you're not paying any premiums. I had it tested 3 times. The savings for individuals was $63 billion a year, and all those 45 million people who are ACA eligible would be completely 100% covered immediately. No enrollment, no nothing, immediate coverage.
Yeah, and one of the things that I see is the epic inefficiency in our current healthcare delivery and infrastructure. That's how you can save tens of billions of dollars.
Absolutely.
Just by wringing some of the inefficiency out.
And that administration cost, that's a function of there being so many different insurers and so many different healthcare plans. If you look at Medicare Advantage, there's 2,500 different plans. That means hospitals have to have administrators and coding elements for every single one of those plans. And that's crazy. And that's why I call this thing the 10 plan. Under the 10 plan, there's just one program and you pay Medicare pricing to the hospitals. And I'll tell you the biggest scam, Andrew, the ultimate scam right now in healthcare. I've turned into a healthcare geek. So they have this group called MedPAC who does all the analysis for how Medicare rates are set. They're being told that hospitals say they lose money on Medicare rates. The reality is it's a great lie. Hospitals are not losing money at Medicare rates. They just throw everything plus the kitchen sink into their cost
into that bucket, into the cost bucket.
Money, right? Look at Toronto, Canada, which has effectively not complete single player, but effectively single payer. And look at New York City, a hospital in Toronto and a hospital in New York. If we line them up, all the costs are going to be the same. The costs for doctors are the same. The cost for real estate, nurses, supplies, overhead, everything. So the question I asked was, why does Toronto pay X dollars for a procedure to the province of Ontario, that hospital, and it's far less than what
New York, it's like 2.5x or whatever it is.
Yeah, and they claim poverty. There's a disconnect there somewhere, and the disconnect is because they throw in all these incremental costs to make it look like their costs are higher, which pushes up the pricing to all the insurance programs, which makes all of our healthcare costs more. And so if we get down to the cost basis of what hospitals truly pay, and now's the time to do it with all this reset, then we can push down the pricing of healthcare costs significantly.
Yeah, amen.
When you and I talked, a lot of time on that.
No, I know. And when you and I talked during the campaign, you were talking about how food insecurity is like a major health issue, and that if you want to try and make people healthy, you got to get good food and nutrition available to them.
Yep. Yeah, there's no question. If you're not healthy, if you're not confident where you live, if you don't have enough food to eat, you don't have basic care, then you're going to be at a disadvantage the rest of your life.